All right, kids, settle down. Let's go ahead and read the story.
Can we have like 2 more minutes?
Thank you, Joe. Now let's go ahead and read this story. All right, everybody. Today we'll be reading a story called 5 Little Osteopaths. 5 baby monkeys drinking spicy milk. One regurs and felt quite ill. Mama called the doctor, and the doctor said,
What do you say?
condylar decompression. Thanks, A.T. Still. Yes,
What is that?
Let's have student Dr. Towsett demonstrate what condylar decompression is.
All right, so sometimes kids, they'll have regurgitation with GERD. So with that, what you can do is some condylar decompression. You kind of go in here behind the head and you go to the occipital condyles, medial to it, and then you just kind of use your ring fingers and you kind of bring it out laterally until you feel a beat of balanced ligamentous tension. Now what you're doing here is you're kind of releasing the tension in the area. Sometimes what can happen is that vagus nerve can get a little irritated. So a lot of the GI tract, it's the visceral somatics are through the vagus nerve. So this will kind of help the child to help with their regurgitation. And you just kind of go there and you just hold it there until you feel that tension release.
Thank you, student Dr. Towsett. Now let's continue with the story. 4 little monkeys were playing with a cat. One was allergic and had an asthma attack. Mama called the doctor, and the doctor said,
Did you say condylar decompression?
no, this time he said, I'll do some diaphragm doming and won't hold back. Yes, Natalie.
What's a diaphragm?
Let's have student Dr. Joe demonstrate what diaphragm doming is.
Okay guys, so now today we're going to do some diaphragm doming. So we have student Dr. Towsett here who's going to help us out because he just had an asthma attack, so he's a perfect candidate for this. So first we're going to start, we're going to go under the ribs where the diaphragm is, and we're just going to screen and see which side is more restricted. So I'm feeling that right side, there's not a lot of movement with it. It's not coming up, it's not going in, it's kind of stuck. But this, his right side here has a lot of movement. So let's go ahead and treat this left side. So as he breathes in, I'm just going to resist. And as he breathes out, I'm going to follow it in. Wait for him to breathe again, I'm going to give it some resistance. And as he breathes out, I'm going to follow it in. And I can feel his diaphragm muscles relaxing now. I'm going to do it one more cycle, and I'm going to let it go. So I'm going to rescreen here. And yeah, it definitely feels like there's a lot more movement. It should help him with his respiratory mechanics, and he should be feeling a lot better. So thanks for helping us out, Student Dr. Towsett. Back to the story.
Thank you, student Dr. Joe. Now let's continue with the story. 3 little monkeys jumping on the bed. One had some ear pain, and his key amp turned red. Mama called the doctor, and the doctor said,
What do you say now?
Dr. Galbraith can help, and his friend N says. Who knows what the Galbraith technique is?
The Galbraith technique is a technique to help the fluid to drain better from the infected ear. So first we're going to take one of our hands on the chin, and then the other on the forehead to stabilize the patient. We have to make sure that the forefinger and the thumb is on the lower border of the jaw. And then what we're going to do is have the patient open their mouth, and then we're going to gently move the jaw away from the infected ear, and then hold it for 3 to 5 seconds, and then release. And we would want to repeat this 3 times.
Thank you, student Dr. Tajin. Now let's continue with the story. 2 little monkeys playing quite rough. One swung the other, and her radial head subluxed. Mama called the doctor, and the doctor said,
Oh my God, you called him again?
yes, she did. I'll supinate and flex it. It won't be that tough.
What is that?
Let's find out from student Dr. Natalie.
Okay. Come on. What just happened to the little monkey was a radial head subluxation, also known as a nursemaid's elbow. When a little kid's arm gets pulled like this, sometimes the radial head will slip out of the annular ligament. But it's a pretty easy fix. So what you would do, you're just gonna take their arm, you can kind of stabilize it at the humerus with one hand, then you're gonna supinate it with this one and straighten it out. You kind of add a little bit of traction, and then you're gonna flex their arm up, and it should pop it right back in place.
Thank you, student Dr. Natalie. Now let's continue with the story. 1 teen monkey growing faster than the rest. She reached down and was side bent left. Mama called the doctor, and the doctor said,
What do you say this time?
dextroscoliosis. BLT could be the best.
What What is that?
Let's turn to student Dr. Casey to learn more about scoliosis.
So, scoliosis is a common diagnosis in teenagers. It's usually when you're going through a growing phase of being a teenager. And it can curve either to the right or to the left. And you're gonna name it after the convexity of that curve. So that's this side. So, student Dr. Natalie turns around for me. To test for this, it's called the Adams test. She's gonna put her hands together in front of her and bend forward down towards your toes. Perfect. So what a positive test would show for dextroscoliosis, that this shoulder would stick out more than this shoulder. The right shoulder would stick out more. For levoscoliosis, her left shoulder would stick out more than the right shoulder.
Thanks, student Dr. Casey. Now let's finish the story. 5 little osteopaths had their treatments done. Now they're off to have some fun.
Yay! It stopped raining! We can go play now!